Okay. Hello, doctors. Can you hear me?
Yes, we can. I can.
Okay. Good. Hello, dear warriors. I hope all of you are managing well. If you don't know me, this is Dr. Sahar Ali, the founder of PLAB 2 Warriors Groups. I do provide full course with mind maps and simulated scenarios. I do provide also practical course. It includes SIMMAN, examination, procedure, and prescription with mind maps and simulated scenarios as well. Also, I do provide one-to-one mocks with detailed verbal and written feedback. So, what is our plan for today? Today, we are going to take two cases of history-based approach in a GP setting. We are going to take the first case in a simulated scenario with one of the doctors. After that, I will give my comment on the performance of this doctor. Then we will discuss together the first mind map in this session. After that, we are going to take the second case with another doctor, and we will do the same as we did in the first case. After that, I will give an advice, tips, and golden guidelines to the starters and the repeaters as well on the preparation. If you would like to hear about this, please stay till the end. All right, so let's take our cases for today. Dr. Christina, hello, Dr. Christina, how are you?
Hello, I'm fine, thank you.
Thank you. I just need to know when is your exam? So I
My
just
exam
uh,
is in 2 days,
in two
actually.
days. Oh wow.
Yeah,
Okay. Okay.
I'm so afraid.
No worries. No worries. Okay, you are practicing on in front of lots of people, so don't be panic. Okay. So yeah, do your best, and inshallah you will do the best in your exam.
I
Okay.
hope so.
Yeah. So we will take Dr. Christina and another doctor. Please, doctors, write down your exam dates so I can pick the closest one to their exam. Okay? Okay, so let's take Dr. Christina first. Can you see my screen, doctors?
Yes.
Okay, good. So, our cases for today are in the history based approach. We have taken two cases in hospital setting. So, today we are going two cases in the GP setting. Okay? You will have 1.5 minutes, Dr. Christina. Okay, prepare your mind, read your question carefully, please. And after that, we are going to simulate the scenario. Read your question, please, doctor. Start, doctor.
Hello, I'm Dr. Christina, one of the doctors here. Forge,
Yes, doctor, I'm Maria Forge.
would you please confirm your age?
I am 45 years old.
Okay, great. How would you like me to address you?
Maria is fine?
Okay, Maria, how are you?
I'm fine. I'm fine, doctor, but I have headache, doctor. I have episodes of headaches. If you can please help me.
Of course, I'm here to help you. Tell me more about that headache.
What do you want to know, doctor?
Like, since when have you been experiencing this pain, this headache?
Yeah, for the last few months, doctor, I have these episodes of headache.
Okay. It comes like episodes?
Yeah.
Okay. Does anything trigger it?
I noticed this, doctor, usually when I came back from my work.
Yeah.
Yeah.
Okay. And have you tried anything to make it better or?
Nothing, doctor, but sometimes I have a couple cup of wine. So yeah,
Yeah.
it helps.
Okay. And do you feel anything makes it worse?
Um, Nothing specific, but I have this headache like the whole night. after coming from my work.
Okay, yeah. So you're telling me that it started like 3 months ago, mostly at night.
Yeah.
Do you have any associated symptoms with it, like you feel sick or you need to vomit or something?
No,
Okay, and any flashing of lights or
no,
pain around your eye?
no, doctor.
Okay. Can you grade how severe that headache? One escape from 1 to 10, where 10 is the worst.
Yeah, it's five, doctor, around five.
Yes, okay. Okay, Maria, I'd like to ask you some few questions about your general health. Do you take any medication?
No, doctor, just I take like paracetamol sometimes.
Okay, that's fine. And do you have any allergy?
No,
Okay, any medical condition?
no.
Okay. What do you do for a living?
I'm working in an agency, doctor, and I got promoted in my job, and it is very hectic.
Yeah, I can feel that stressful job, right?
Yeah, it is very stressful nowadays. Yes, doctor.
Oh, okay. I'm sorry to hear this, but I'll try to help you as much as I can.
Okay,
Um, I'd like now to make examination. Is that okay with you?
okay,
I'll take your observation, blood pressure, temperature, heart rate, and also I'd like to do some investigations. Okay. uh, Is there any examination findings?
all of the examinations are normal, doctor.
Okay, Maria, from my examination and from what you've been telling me, I suspect that you're having something called tension headache. Have you heard about it?
No, doctor, what is that?
Yes, it's more about headache due to that stress you're facing in your work. Most probably, it's just related to that stress, and if we can find ways to reduce that stress, of course, things would get better.
Okay.
What do you think?
Yes, okay, doctor. But
Okay.
can I do CT on my head, doctor?
Oh, CT. Oh, why do you think you should do CT?
Because I have this headache, doctor, for a long time now. It's for a few months now. So I'm concerned about it.
Yes.
It could be something serious or something like
Yeah, I
this.
understand. Yes, your concern is valid, of course. But let's first do that simple investigations first, because CT is like too much radiation to. Of course we can do it, but when we suspect something more sinister. But I think in your case, things can be just better if we can control that stress. Maybe you can do some things like. Um, Decreasing the working hours. Do you think you can do this?
Uh, I don't think so, doctor. So is there any kind of
Yeah,
strategies other than this?
maybe sorry, I forgot to ask you about your exercise. Do you practice any type of physical exercise?
No, to be honest, no, I don't have time for this.
Yeah, and what about like trying to go for a walk like 30 minutes every day? I think this will help you so much with the stress. What do you think?
Yeah, I can try something like this. Yeah.
Yeah, that's great. And what about your diet? Do you eat healthy foods?
Yeah, I'm trying to eat healthy as much as I can. Yes, doctor.
That's great. Okay. Maria, for now, I'll try to do some blood investigations, like routine bloods, and just to check that everything is going okay with you,
Okay.
like no exclude anemia or something. And just would follow you up in a week to see the results, and try to do that simple exercise, and I keep try to sleep as early as possible and get yourself to rest. and if all these simple maneuvers didn't make you better, of course we can then refer you to a specialist. He may then do some further investigations. Is that okay with you?
Okay. Okay, doctor. Yeah,
Okay,
no
Maria,
problem.
anything else you're concerned about today?
No, thank you, doctor. Thank you so much.
Thank you. See you.
See you. Bye.
Bye.
Okay. Good. Thank you, Dr. Christina.
Thank you. Thank you.
You did it well, Dr. Christina. Good job. So
Thank you.
please be like confident and do what you do now. Okay. So this is a good thing. So yeah, I hope you do well in your exam, inshallah. So how do you
I hope.
feel? How do you feel before I give you the marks?
I was very tense and stressful because actually I didn't practice so much, so that's why I feel I'm doing bad. But I think this case is simple. That's why I think I've done it somehow. Maybe I don't know, but I hope it's fine.
Yeah.
I think I managed the time. I finished at time, right?
Yeah, you managed to finish before the time. This is a good thing. Okay, yes, it is a simple station, but sometimes people they manage
Panic. We always panic.
they manage the medical treatment. They manage the medical problem, like telling you
Yeah.
have tension, you have this and this, take painkillers, and that's it. They
Mm.
don't address the patient's concern. They
Yeah.
don't they don't involve the patient in many ways, so this is the problem. Okay. So yeah, you did it well. Just let me give you the marks. I just need to, yeah. Okay, good. So in data gathering, so you explored, asked anything else, and also asked the past history, the personal history. You asked about exercise and diet. Yes, you have forget to ask about it in
The first
the
place.
first, but it's fine. It's totally fine. Okay, as long as it is in a logical way of thinking, it's fine. Um, what else? You can ask me about the effect on my life, on my mood as
Yes.
well. It will be better. Why? Because I have this problem for a long time. So please consider the psychosocial part in your mind in the stations.
Agree.
Okay. This is regarding the data gathering. So in data gathering, you can take like three. Management skills. You addressed my concern, you talked with me, blah 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 blah. Okay, so I could give you like three as well. Okay, you just missed what you missed. I will tell you what you missed now in the data gathering, in management skills and interpersonal skills. In interpersonal skills also I would give you three. Okay, so
Okay.
nine. In what, you have a tick in the nothing, to be honest. A small tick in the management maybe. You didn't, but you can tell me about the painkillers
Yeah.
to take it while I have the episode. You can ask me, is it affecting me in a bad way? Maybe you can give me
Yeah.
an option to start a cognitive behavioral therapy. It's a kind
Yeah.
of treatment as well. Okay.
Yes.
This is regarding the your marks. In data gathering, I told you that you have missed the psychosocial part, and please ask me about ICE, please. Ideas,
Yes.
concerns, and expectations. Expectation, you didn't, yeah, you asked ICE, not as a block, you asked it during the station. Okay, it's fine.
Yeah.
Yeah. In
Okay.
management skills, as I said to you, you can give painkiller, you can talk about CBT.
Okay.
Give leaflets, please. Give leaflets to the patient. You can't let the patient go home without giving leaflets, and safety net the patient. Okay, this is
Okay.
what you missed in the management. Leaflets and
Yes.
safety. Interpersonal skills are fine. I don't have any problem in interpersonal skills. So this is regarding the marks. Let's talk about the headache, the maps. Okay, this is a small map about the headache, okay, from the exam point of view. It's from our course. I just need to tell you some points or how to think about headache from the exam point of view, and then we are going to discuss our lovely map, tension headache map. Okay, we have two kind of headaches: primary headache and secondary headache. Okay, in the primary headache you will think about what? Cluster headache. We have cluster headache, we have migraine, what else? We have tension headache. All of these are primary headache. It is without any obvious cause. Yes, there is a trigger for these headaches, but there is no obvious cause. Okay, we have also secondary headache. This secondary headache is due to a specific cause, like meningitis, like subarachnoid hemorrhage, like giant cell arteritis, alcohol. All of these are secondary headache. If we think about headache from the exam point of view, we think like if the patient is presenting with one episode of headache and he has headache now. The other category is episodic headache. The patient doesn't have any headache now, but he is presenting with episodes of headache. The first category, we have meningitis, subarachnoid hemorrhage, giant cell arteritis, and alcohol hangover. When you think about these headaches, please try to exclude your red flags. What are your red flags in acute headache? It's in this lovely picture. We have a beautiful man here. He is sad because he has headache. So we need to find out why he is sad and what is the kind of headache he has. If we think about the layers of this man, we have the skull. The first thing you can think of is trauma to the head. Then meningitis, asking about do you have any fever, any rash, any shyness from light. Then the brain, think about subarachnoid hemorrhage. When you think about subarachnoid hemorrhage, ask about stroke symptoms, facial weakness, arm weakness, and slurred speech. Then you can move on to the eyes. Ask about any problem in the vision, blurry vision. Do you have any pain in your eye? To exclude glaucoma. After that, you can think of sinusitis. Sinusitis is not a red flag. It's a differential diagnosis. It's a differential diagnosis, and if you don't ask about it, it's totally fine. It's not a red flag. Then we have giant cell arteritis if the patient is presenting with headache in the temple with jaw claudication. Then the mouth, you can think of alcohol if he is drinking alcohol. These are the acute episodes of headache, if you can think of this picture. Please, any acute headache, ask about meningitis, subarachnoid hemorrhage, and eye symptoms. All right? Then, in episodic headache, it's a kind of chronic attacks. We have migraine, tension headache, and space-occupying lesion. In this category, please exclude the space-occupying lesion symptoms or cancer brain. It's in the blue circle here. Ask about what? Ask about morning vomiting and headache. Ask about vision problem and also flaws. Flaws are the symptoms of cancer, fever, loss of weight, or lumps and bumps. Okay? So acute headache, the red flags are meningitis, subarachnoid hemorrhage, vision. Chronic headache, the space occupying lesion, and flaws. All right, this is regarding the differential diagnoses and how to think when you have a patient with headache. Then our lovely map, you know, in our maps we divide the maps into halves. The first half is for the data gathering, history taking, examination and investigations. Then the other half is for diagnosis and management. All right, okay. Then what you will do, you will greet the patient and introduce yourself. Then take your present history. The patient is presenting with headache. Ask him or ask her, can you please tell me more about your headache, please? She will tell you, doctor, I have headache. What do you want to know? Tell her, do you have headache now? She will tell you, doctor, no, I don't have headache now. I have episodes of headache. When she tells you, doctor, I have episodes of headache, please explore the episode. Don't explore the headache itself like a pain. Okay? Save your time. Ask about when usually do you have these episodes? How frequent? How frequent to check the severity of these attacks? Is it frequent, like 2 or 3 episodes a day, or how frequent they are? Okay? Then, what is the trigger? And can you please describe the headache during the attack? And after that, ask her, does this headache or pain go anywhere else while you have these headaches? Is there any specific is happening before the attacks? Then, in anything else, ask about morning vomiting and vision problem and flaws. These are your red flags in episodic headaches. Then you will move on to your past history. Do you have you had these attacks before? Do you have any medical condition, any medications, any allergies, any family history of similar headaches? Similar, please. When you ask about family history, ask family history and specify the family history. Do you have any family history of similar headache? And in family history, you can ask about cancer. Okay. Then in personal history, you can ask about exercise, smoking, and alcohol. And in S, don't forget stress and sleep, because they can be trigger to these attacks of headache. All right. In 4Ps, you can ask if she's pregnant or not. I think she's 45, so you can skip this question. In psychosocial, please ask about the effect on life, job, and mood. I told Dr. Christine I have this headache when I come back from my job. So the trigger is my job. It is a stressful job. So she will address my concern regarding my job in my management. All right. Then, do you have any idea what might be causing this headache? Do you have any concerns at all today? Do you want any or do you think about any expectations today? Then examine the patient. You can check the observations, examine the head, nerves, and vision, please. Head, nerves, and vision. Everything will be all right in your investigations. You can skip investigations, no specific investigations with tension headache. You can do as Dr. Christina did, just ordering some basic investigations like full blood count. Then you will move on to your diagnosis. In your diagnosis, please, doctors, please try to summarize the important points in your history taking and explain the examination to the patient. Tell the patient, so Mrs. X, you have mentioned to me you have these headaches for since few months, and I think the problem is started after you have the promotion in your job. When I examined you, I found that everything is normal. This is a good thing. So I am suspecting, or these are suggestive of what's called tension headache. Have you heard about tension headache before? No, doctor, what is that? It's a type of headache presenting with these symptoms that you have. It is a very common health condition, so don't worry about it. It is manageable with some strategies. Everything will be all right. So you try to reassure her, okay? And you will tell her it seems that the cause in your case is what? Is your job. So let's talk about how to deal with this headache and how uh, to think about some strategies regarding your job. Would you like to know our management plan? Yes, doctor. Then regarding your job, um, her concern is what? His concern is doing CT. Regarding your concern, you have mentioned to me that you want to do CT scan. I totally understand that you want this, but can I ask you why you want to do something like this? Yes, doctor, because it might be something serious. Tell her, okay, I can see how you are worried about this, but I don't really think that it will help you in your condition, because as I mentioned, you have a simple headache, and all of the symptoms that you have and all of the signs are reassuring. You don't have any alarming signs like morning headache or like morning vomiting or visual problems, so it's totally reassuring. Let's think about how to manage that, and if it didn't help, we can think about other solutions. What do you think about this? Yes, doctor. Okay, so I will give you some advice on how to deal with this headache and how to decrease the stress in your job, to decrease the frequency of having these headaches. What do you think about this? Yes, doctor. Okay, so please, during the attack, try to take some rest. Try to take a simple painkiller like paracetamol or Nurofen or something like this. It will help you a lot. Okay, and try to write a diary to check what is the trigger. And I think the trigger here in your case is your job. So please, what do you think if you can take a leave from your job or decrease the time of your work as Dr. Christina did? No, doctor, I can't. Okay, so what do you think if we can try something like relaxation technique? I can give you leaflets regarding this. It will help you a lot. What do you think about this? Would you like to try this? Yes, doctor. Okay. In addition to that, you can have good time of sleeping and also good posture, and these things, it will help to decrease the frequency of attack. And if you think if it is affecting you a lot, we can start you on something called cognitive behavioral therapy. It's a kind of talking therapy to help you manage your stress and how to teach you how to cope with this stress in your job. What do you think about this? Would you like to try something like this? Yes, doctor, or no, doctor? Then safety net her regarding any severe headache or worsening of symptoms. Please do seek medical advice. Do you agree on this? Yes, doctor. Yes, doctor. And thank you, thank you. Done the station, and we have finished tension headache. Okay, so this is regarding the first station. Time for advice. So, my advice today is what? About preparation. Before anything else, preparation is the key to success. Okay? Failing to prepare is preparation to fail. I'm afraid. So, prepare well, doctors, and you will find that everything will be all right. So, after finishing the two cases, the second case, I'll talk about how to prepare. We have talked about the start in the last session, how to start, or you got the decision to start. Then today we are going to talk about the preparation. After that, we are going to talk about practice and how to do effective practice, inshallah, in the next session. So I decided to talk about preparation at the end of the session because we have other doctors who have their exams close, and the time is precious for them. So good luck. Good luck for all of the doctors who are giving their exam in the next 2 weeks. Good luck, Dr. Christina. Be confident, please. Be friendly. Acknowledge and reflect. Address the patient concern the first thing in your management, please.
Okay.
Be patient centered, and you will be on the top, inshallah. And I will pray for you, for all of you.
Thank, thank you so much.
Thank you, Dr. Christina. Okay, so let's do the next station with the next doctor. Just let me stop screen sharing. Okay, read your question, please.
Okay.
Start, doctor.
Hello,
Hi.
Lydia Cornell. Am I correct?
Yes, doctor. Yes, Lydia
Okay,
Connell.
I'm
Yes.
Dr. Emmanuel, a doctor in this JP clinic.
Hi, doctor.
Would you mind if I call you Lydia?
Yes, Lydia's fine, doctor.
Thank you, Lydia. I am pleased to meet you today.
Excuse me, doctor.
Okay. Thank you, Lydia. I am pleased to meet you today.
Yeah, thank you. Thank you so much.
Okay, I understand that you have come to see us today because you have some eye problems. Am I correct?
Yes, doctor. I have my eyes are blurry. Yes, I have blurry vision, doctor.
Oh, okay. Well, you have done the right thing by coming here today, Lydia, and let me assure you that we'll do our best to be of help to you. Okay?
Okay, doctor.
Could you run me through what's going on with your eyes?
I have blurry vision since yesterday, doctor. I don't know what's going on with my eyes.
Mm-hmm. Okay. Can you think of any trigger for this blurry vision?
Nothing specific, doctor.
What were you doing exactly when this blurry vision started?
Can you please raise your voice, doctor, because I can't hear you?
Okay. What were you doing when it started?
I was watching TV, doctor.
Okay. Is it getting worse?
It is getting worse, yes, doctor.
Okay. Have you tried anything yet?
No, I didn't. I didn't try anything. No, doctor.
And has this happened before?
It happened. Yes, I had this blurry vision 3 months ago. Yes, the same
Mm-hmm.
problem.
And what did you do to relieve it?
I didn't do anything. It went on its own.
On its own. Okay, Lydia. Apart from this blurry vision, what other complaints have you noticed since yesterday?
Excuse me.
Apart from this blurry vision, what other complaints have you noticed since
Yeah,
yesterday?
I have some pain in my eyes, doctor.
Mm-hmm. Which eye? Left eye or right eye? Or right eyes?
Both of the eyes, doctor.
Both of them. Okay, Lydia. I'll be asking you a few yes or no questions just to make sure I don't miss anything serious.
Okay.
Okay.
Yeah.
Any headaches?
No.
Any eye redness?
No.
Eye discharge?
No.
Vomiting?
No.
Any circles around light?
Any?
Circles around light
No.
or halos around light?
No. No.
Oh, okay. Any numbness in your legs or hands?
No, doctor.
Weakness in your hands or legs?
No.
Oh, okay. Do you have any medical condition?
No, doctor. I don't have any medical condition.
Are you on any long-term medications?
No.
Okay. Are you on any contraceptive?
No, doctor.
Okay. And by any chance, are you pregnant?
No, 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 I'm using condoms. No.
Okay, very good. When was your last menstrual cycle?
It was 1 week ago.
Oh, very good. And any allergies at all?
No, doctor.
Any history of similar issues in your family?
I do have my mom has multiple sclerosis.
Okay, okay, okay. And how's she doing now?
She's fine, doctor, but I'm concerned if I have this problem as well or not.
I I see. Okay. And then do you smoke cigarettes?
No, doctor.
How about alcohol?
No.
Okay. And has this affected your life in any way, like your work or anything at all?
No, doctor, it was just the last night, so yeah, nothing, no.
Nothing else. Okay. So what were you hoping I could do for you today?
I just need to know what's going on with my eyes.
Okay. And you mentioned that you are concerned about multiple sclerosis. Am I correct?
Yes.
Any other concerns at all?
No, doctor.
Okay, thank you very much. If I heard you correctly, Lydia, you said you have had this blurry vision since yesterday, and along with this, you also have pains in your eyes. However, no discharge, no headache, no vomiting, and no numbness in your hands or legs. Am I correct?
Yes, you're correct, doctor.
Okay, yeah, I'd like to examine you now. I will check your temperature and other observations. I'll
Okay.
also examine your eyes and look at the back of your eyes with a special instrument. I
Okay.
also like to check the pressure in your eyes. Is that
Okay.
okay with you?
Yes, doctor. The
Any 5 minutes,
examination,
please?
yeah, the
Mhm.
examination is here.
Okay, let me see. Okay, Lydia, you mentioned that you are quite concerned about multiple sclerosis. I want to reassure you that what you told me so far does not look like multiple sclerosis. Because having listened to you along with my examination, I am thinking you have a condition we call acute angle glaucoma.
Excuse me? What?
I am thinking you have a condition we call acute angle glaucoma.
Okay.
Have you heard of that before?
No, doctor. What is that?
Okay. It's simply a condition whereby there is buildup of fluid in the anterior part of your eyes. And when this happens, Lydia, it leads to increase in pressure of the eye, leading to symptoms like pain and blurry vision as you have experienced so far. Does it make sense at all?
Yeah, doctor, it makes sense, yeah?
Okay. Since it is new to you, Lydia, at the end of this discussion, I will give you a leaflet which contains everything about this condition. Would you like that?
Okay.
Okay. Any sense so far or any question so
Yes, doctor. Is it serious?
it- unfortunately, Lydia, it is quite a serious condition if it is not treated immediately. So what I intend to do for you is that I will refer you to a specialist who will carry out further investigations on you and also manage this accordingly. Would you like that?
Okay, so when you will refer me, doctor?
I will do that instantly. However, before I refer you, I would like to give you a pain medications to help relieve the pains you have in your eyes.
Okay.
Is,
Okay.
is that okay with you?
It is okay, doctor.
Oh, very good. So I will try to facilitate the referral now. However, Lydia, if you begin to experience like worsening pain, for example, or let's say weakness in any part of your arms or your leg, please do ring a bell immediately. Can you do that?
Okay, doctor. Time's done.
Oh,
Okay.
yes.
Thank you,
Mhm.
Dr. Emmanuel. Thank you so much. So,
Thank you, doctor.
how do you feel?
Wow, I don't know what to say. Don't know what to say.
Okay. Okay, no worries. So, just let me hide the floater. Yeah. Okay. So, what do you think is the diagnosis here?
Multiple sclerosis, optic neuritis, sorry.
Yeah, optic neuritis. So, why didn't you tell me optic neuritis?
Actually, I was kind of distracted actually by the exam finance initially.
Yeah, so because acute angle closure glaucoma comes with nausea, vomiting, severe pain,
That's right.
halos
Mm-hmm.
around the vision and these things. Okay, so yeah, so this is the problem, and the patient has an attack like this before, so all of the history is going with what? With optic neuritis.
Optic neuritis.
Yeah.
Forgive
Okay,
me,
this is
please.
the
Forgive
point.
me. Forgive me.
So, yeah. Okay, so let me give you the marks. So, in data gathering, in the first part of the station, you were perfect. So you asked me the exploration questions. You have excluded the red flags, the past history, personal history. All of these are perfect. Even the examination and investigations, you were very good in interpersonal skills. So in terms of the data gathering, I would give you 3, okay, or 4. Um, in the management skills, I'm sorry, I will give you um, 0 or 1. Sorry, but because you gave me, it's not a working diagnosis, to be honest. It's not a working diagnosis. If it's working, or if you give me like another differential diagnosis which is um, relevant to the history taking, I would give you 2 or 3, but this is the point. So the management skills are, yeah. Interpersonal skills, I don't have any problem in the interpersonal skills, but by taking 0 in one of the management skills or in the quantitative domain, I think they will give you 2 in the interpersonal skills and 2 in the data gathering, because you can't take 0 in one of the stations and take 4 or 3 in others. It occasionally happens. It occasionally happens. Okay. So yeah. So the problem is in the management. That's it. In the management and diagnosis. All right. So this is regarding the station. If you give me optic neuritis, I would give you 333, so 9. Okay. Yeah. So thank you, Dr. Emmanuel. You did well. The only thing is the management. You just try to go with your logical thinking, because you have told me it's optic neuritis after finishing the station. Okay, so go with the right diagnosis. Yeah. Do you have any question before we start the talking about the mind map?
Thank you very much, doctor. Actually, I was a bit distracted, yes, so I didn't really focus on the
No worries.
diagnosis
Yeah, I think
aspect.
there
So
was a
sorry about
problem
that.
in the internet connection at your side. I don't know.
Yes,
Yeah.
yes,
Okay.
doc.
No worries.
Actually, the patient gave me a hint in the multiple sclerosis. Actually,
Excuse me.
I said the patient gave me a hint that the mother has multiple sclerosis as well.
Yeah. Yeah. So let's talk about the station quickly. The mind map. We have optic neuritis mind map. Okay, the patient will present sometimes with blurred vision, sometimes with eye pain. Okay, so you can find the patient with eye pain, presenting with eye pain. So you will explore the pain, and in anything else, you will ask the same questions and ask about blurry vision. All right, and you will move on the station as it is. Here, the patient is presenting with blurred vision. Any blurred vision, explore it like this. Which eye? What about the other eye? Any pair compare. So you have 2 eyes. So which eye? What about the other eye? When you have this, how did it start? If sudden loss of vision, ask about, is it partial or complete? Then do you still have this blurry vision or not? Any specific thing happened after that anything else. You will exclude your red flags, and also you will try to find out what's going on. So any blurry vision, ask about pain. Any pain, ask about vision. All right. So he will tell you, or she will tell you, doctor, I have pain in my eye. It's increasing with movement of the eyes. So you will try to exclude glaucoma. Do you have any nausea, vomiting, any halos? No. So glaucoma is no. Then, do you have any headache? No, as well. So glaucoma is no. Uh, do you have any discharge, any glasses? Do you wear any glasses, any lenses? Then fast. Any facial weakness or arm weakness? Then, have you had this before? Yes, doctor, I had this before 3 months ago. So you most probably will think of what? Optic neuritis, because it comes in attacks. Medical conditions, no doctor. Medications, no. Family history of similar condition or any immunological problem, you can ask this because you are suspecting optic neuritis. So ask about family history. She will tell you, doctor, yes, my mom has multiple sclerosis. And how is she now? She's fine, doctor. Okay. Is there any chance you might be pregnant? No, I think she's 40. So you don't need to ask about pregnancy. Ask about pills. You can ask. Then psychosocial. In psychosocial, it's since uh, the last night. Okay, so you can ask, and since the last night, do you have any affection in your life, or any problem, anyone with you, or anyone to be with you here at home? No, doctor, or yes, doctor, whatever. Then ask about driving. Who brought you here? Who brought you here? And in your management, tell her, please arrange anybody to be with you or to drop you off to the hospital, because it's unsafe to drive if she is driving. Okay. Then, do you have any ideas of what might be causing any concerns? Yes, doctor, I am concerned if it is multiple sclerosis. Why you are concerned about this? Because my mom has this problem. If she told you from the start, her mom has multiple sclerosis, tell her, okay, I understand your concern, or where are you coming from? So is there any other concerns? No, doctor. Then examine the patient. Observations, eye, fundoscope, and visual acuity. You will not do any investigations because you will refer the patient to the specialist. All right. You will tell the patient, you have this and this and this and this. By examination, I found that there is an inflammation of the nerve supplying your eyes, in addition to decreased color vision. So all of these are suggestive of optic neuritis. Have you heard about this? No, doctor. Okay, it's an inflammation of the nerve supplying the eye. Sometimes there is no cause, no obvious cause for this. Sometimes as a part of multiple sclerosis. You are concerned about multiple sclerosis. I totally understand that you are concerned about this. You might have, you might not, we don't know. So the best thing is referring you to the nerve specialist to do their further investigation to know what's going on. All right. Then tell her the prognosis. It has a good outcome even without treatment, doctors. The vision is reversible. Okay, if she tells you, doctor, will I lose my vision? Tell her it has a good outcome. Lots of cases can recover fully, but some of them could have impaired color vision. So would you like to know our plan of management? Yes, doctor. Okay. So the best thing is referring you immediately to the specialist to treat you, to prevent any further inflammation and to speed the recovery. Do you think it's a good idea? Yes, doctor. Okay. And before that, I will give you painkiller for your pain, just to cope with this pain. All right? Yes, doctor. Okay. Would you like to hear what will happen there in the hospital? Yes, please, doctor. They will examine you, assess you, give you corticosteroids, or treatment to ease this inflammation, you might be seen with the nerve specialist to see what's going on. Is it okay with you? Yes, doctor. After that, we can talk about how to prevent that from happening again, how to deal with this problem and these things. They after discharging you there in the hospital, they will give you leaflets. They will follow you up here in the GP or in the eye clinic, and they will give you some safety measures. So, do you agree on this? Yes, doctor. So, when you talk about the management points, talk about them in a logical way of thinking. You are going to admit to send the patient to the hospital. The patient is having blurry vision, so you are not going to give her leaflets now. She will not read anything, okay? You are not going to follow her up until the specialist see her, okay? So please, when you give the management, think about the situation, think about the logical way of thinking. This is part of your consultation, and if you are having or if you lack logical way of thinking, you will have a tick in consultation. Okay, all right, so this is regarding optic neuritis. So let me give you the quick tip about preparation, then I will take your questions. All right, so quick tips about the preparation. So you need to bear in mind there's no one way for best preparation. All right, we all different, with different abilities, with different circumstances. Okay, so what I am going to give are guidelines and not a must, and sorry, and not a must. Okay, you can modify them based on your circumstances. All right, the first thing you need to know what is PLAB2 test, and you need to know what are the marking criteria and how you will be marked in the exam. And you can find this in my first video on my YouTube channel. You can listen to all of the videos in my YouTube channel. Let me tell you something about my YouTube channel quickly. I just don't want to share this one. Okay. Can you see my screen, doctors, now?
Yes.
Okay. So this is my YouTube channel. Okay. You have, this is the home. All of the videos here. These are my videos as well. These are the videos by me. Okay. You have also a playlist. If you click on this one, you will have playlist, the playlist of my the warriors mock. You will find the previous mock and also the other mocks. Each mock will be uploaded on this category, PLAB2 warriors. Okay, also you will have some useful videos on prescription. It's collected by me. Simman videos as well, examination videos, and teaching. All of the examination and procedure videos, all of them are useful videos. You can use them. All right, here in my videos you can see the first video. This is the PLAB2 introductory video. You can find the marking criteria and what are the quantitative and qualitative domain, and how are you going to be marked in the exam. So please watch this video. This video is for preparation. You can watch it. Another video for tips for before the exam. You have also the other videos are videos in which you will find that I teach each skill of the marking criteria in 5 or 10 minutes to know how should you do, how you conduct this skill in a perfect way, and when you have a tick, why you have a tick in this skill area. So I have taught all of the skills area. Just the rapport and the management are left, and I'm working on them. Okay, so visit my YouTube channel. You will find useful things, okay, useful resources and videos. So please visit it and subscribe. Okay, then so this is regarding the YouTube channel and the first tip in the preparation. Okay. Okay, the second thing, what is the second thing? The second thing is to find out nice resources, good resources for preparation. Just a second. Yeah. Okay, find out the resources, the courses which suits you. You will never find that all of people like one mentor. Okay, we all different, and you will find some mentor whom are you comfortable with. So go with it, okay? And what suits you doesn't mean that it should suit others, okay? Think about yourself, think about your beliefs. Yes, take an advice from other people, take an advice regarding the advantages and disadvantages of this course, the way of the teaching in the courses and these things. Take the advice, but do what you are comfortable with. All right? This is the second thing. The third thing, please make a realistic, balanced plan. Consists of studying and practicing as well. Okay? Please, practicing is very important. It is not enough to watch and listen only. Please practice, practice, practice. And we are going to talk about practice in the next session, inshallah. Okay, I am sure that all of you know about the principles, and it is very important to acknowledge, it is very important to be patient centered and these things. And when I ask some of you to answer my question, they will tell me, yes, we need to acknowledge, we need to reflect, we need to do this and this and this and by heart. But the problem is applying this on your practice. So practice is very, very important. Please, you need to do a plan for the practice and the study. What does that mean? Try to write down a timetable or schedule for you. Today I'm going to listen to this lecture, and after that, the day after, I'll practice on these cases. Then the next day, then the next day, then the next day. So by ticking the boxes, you will find yourself, you are getting along and going forward in your preparation. So it's a very good point. Please try to do this. I have a study plan in my course for my candidates. It's for the course content, so it will not suit everybody. So it's exclusive for the course content. So it's very important to do a study plan. Okay, this is the third point. The fourth point is what? Tell others that you are preparing for an exam. So they will encourage you, they will give you support, they will pray for you. Okay? So tell others. And then after that, it's a very important tip. Please try to take one mock, okay? One mock to know where you are. What are your weaknesses? What are the strong points in your practice? And the mentor will tell you some tips to help you in your practice. So it is very important to know this from the start, before these mistakes that you have or you are doing, before it be a habit with you. Okay, and at that time it will be difficult to get rid from them. Okay, so try to take a mock. I have one of the candidates. This candidate took with me, like, this candidate started from the scratch with me before I give them before I start my course. This candidate took like 1, 2, 3, 4, 5, 6, 7. I think seven mocks. I think 7 mocks with me. Yeah. And this candidate passed her exam from the first attempt. She took the mocks with me, and then she went to her academy. After that, she went to the exam, and she passed. The candidate passed from the first time, from the first attempt, and I was so happy to see the candidates progress from the start till the middle till the end before the exam, with the success. So it is very it was a very good and nice experience with me. So yeah, it's very important to take a mock with anyone, with any doctor who are you comfortable with. Take a mock before you prepare, before you start your practice, just to know where you are. All right. Then the last thing in your preparation, find out a nice good partner who will be your mirror, will tell you your mistakes, will tell you, no, you did this thing wrong. You should do this thing in a better way. No, you were hesitant in this part. No, please try to do this in a better way. Try to listen to yourself and find out another way. So he will be or she will be your mirror. Okay? So this is regarding preparation. The last thing is finding out a partner. To find out a partner, you can post everywhere. You have many groups. Post in all of the groups every day. You will find, definitely will find 1 or 2 or 3. All right? After that, you will start your practice. And in the next session, we are going to talk about practicing. Okay. Thank you so much, doctors. Thank you. I hope it was helpful and useful. So let's finish and let's talk about your questions. I will try to answer all of your questions, inshallah.